Now it's recording.
Okay. First, you need to wear your gloves with the blood culture. What is your draw for if you're collecting blood culture? Aerobic and anaerobic. So you collect blood culture, then you collect blue, then
Orange,
and then purple and white. For the pediatric, we have exactly same draw folder. For pediatric, we only collect one, which is a pink, and they are just a little bit different. I don't have it, but you collect only one for pediatric or for difficult collection. Also, you have a same draw folder for pediatric collection. So you have blue, which is citrate. You have gels, which is a SST. You also have EDTA, which is purple, and you also have a flux, which is gray. So draw of water is blood culture first, then blue, then orange, then purple or pink, and gray. You also have a two type of needle. You also have two type of needle, which is a black needle for vacutainer, not a butterfly. Butterfly, you have a 23 gauge blue butterfly, light blue. But you have a black vacutainer, which is 22, and then you have a green needle, which is a 21 gauge. Then you also have a butterfly for 21 gauge, and you also have a blue butterfly, which is 23. Talisha is about to give me a blue butterfly, so I'll show you. Here we go. So you got a two butterfly. This is for your pediatric or elderly patient. You use the back of the hand, and then you use a green. It's for blood culture. So if doctor requests a blood culture along with your bloods, you collect with the butterfly. You also have, there are different type of blood butterfly in the market depending on your facility. So this one, which you can see here, it's a push button one. So I'm going to show you how to use this when you are in your facility. They use a push button butterfly. But this one is a wing,
same gauge.
yeah, same, 21 gauge. And this is a 21 gauge. Also, you require, if you're collecting with needle and syringe, butterfly with syringe, so you also need either 10 ml syringe or you also need a 5 ml syringe, depending on the amount of bloods you need. Also, you need a blood transfer device. Blood transfer device is, say, pretend that you have collected blood. You attached your blood transfer device, pick up your the tube, so say like you pick up your EDTA tube and you just and then it will stop itself. So this is a blood transfer device. This is only for use for if you need to use a big tube, not for the pediatric. For the pediatric, what you need to do, if you happens to collect a coag, which is a blue top tube, what do you do? Pretend there is a blood in it. You just have to pierce it. And you need to make sure it has to be up to the line. Then, invert. How many times? 3 to 4. Then you pick up your biochemistry, open up the lid, make sure you pour 600 or maybe up to the line or 500, and then you close the lid properly, invert, and then so on and on. Would you use a PPE?
Yes.
What PPE would you use? As you can see, I'm wearing a gown. I'm also wearing a glove. I'm also wearing a eye mask or eyewear and mask if you want to, because some people are, filmed and all. So make sure you use your PPE. Now we're going to use a proper technique. So doctor requested, one more thing I want to show you, how to assemble the needle. I'm going to show you how to assemble the needle. So what you need to do, if you have, this is a green bit and this is a white bit. So green bit's got a needle. So you twist it As soon as you see this brown part, make sure it's a double-sided, so it's got a needle as well. You just pick up your barrel and just tight. Make sure it's tight. So this is assembling the needle. When you assemble the black needle, it's exactly the same thing. You twist, barrel, and then secure it properly. Now, how do you apply tourniquet? You pick up the tourniquet, make sure the tummy is in your non-dominant hand and the mouth. So you just have to 4 fingers of 10 to 15 centimeter up. Under, not over. Under, make sure you apply pressure. Just 2 fingers or 1 finger. Make sure the reason you cover because you don't want to pinch. And then tight, 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 tight. You feel for the veins with non-dominant hand, not dominant. Non-dominant hand. Slightly, how do you release it so it's a C shape? And then you need to. So now it's slightly loose in the tourniquet. So what you need to do, you need to prepare your equipment, right? So you already have prepared your straight needle. Now you need a alcohol wipe or swab. Why do you use the alcohol swab? To disinfect. So you need to open up your alcohol swab. I'll show you how to use it. You don't have to be very precise, like that. You need to just pick it up. So we're not using the arm, so I'm gonna show you. Say like I use my students. So you just drop it. And then you just anti-clockwise or clockwise? Clockwise. It's like a snail. See, snail is just around motion. So down and then upwards. I don't want you guys to do this. It's not a good idea. What's happening in like this? You're containment. If you happens to do this, what you need to do, grab another one and then down and then anti-clockwise or clockwise. Either way. You need to let it air dry. Make sure you let it air dry, okay? So after air drying, we're pretending that we have air dry. Make sure you air dry, and then what you need to do? Anchor. I'm gonna have all my equipments here. Make sure I've got a band-aid. You use your kidney dish. Non-dominant hand. Your sharps. Dominant. Now what you need to do, you go back, tight the in your venipuncture checklist, which is provided in Moodle, they ask you to, when you go back and repalpate the vein, you need to make sure you wipe your fingertip with your alcohol swab. So you just pick up the alcohol swab and just wipe it and recheck vein, and then what you need to do, you pick up the needle. How are you going to pick up the needle? Not like this. You're not inserting a needle like that. What you're doing, like 2 finger, and then you're holding it like that. Yes? When you unsheath the cap, make sure bevel is up. Why bevel is up? Because
blood.
So you hold on to it. Make sure you go back and check your veins one more time that yes, you anchor it. What you need to do, you need to anchor far away, not like this. What's happening? Needle stick injury. You need to make sure it's far, far away. Yep, and then you need to insert. How many angles degree? 32? 20 to 30 or 15 to 30? 50 to 30. Yeah, here we go. And how far you need to go? 4 centimeters. So we do it one more time. Look for the veins. Anchor. You can anchor thumb or finger. Does not make any difference. Insert. Correct draw of order. In your venipuncture it says correct draw of order. So doctor only requested a EUC. For EUC it's a gel top tube. So you need to, how are you going to insert? You need to make sure that you have that motion, and you just have to click it. When you click it, the blood will come. So when you finish, what you need to do, you take the tube out, you invert. How many times?
8 times.
8 to 10 times. Invert, you finish, you put the tube down, release the tourniquet. Pick up the cotton, apply pressure straight in the bin. Ask the patient to hold the cotton. And then you need to do exactly the same thing. So this is a straight needle method. Yep, and then you just have to label it, make sure you put a barcode. What is a mandatory requirement on the tube? Last name, surname, date of birth, gender, male or female, time of collection, which is T or C, date of collection, which is D or C, initial, and did I say barcode? Yes, barcode. And would you flag it? You only flag it if it's required to do so. So we can